Okay, we've seen children being hospitalized for COVID-19, that number skyrocketing in the past few weeks. What are you guys seeing there at Dell Children's?
So we are seeing a steady increase, and the number of patients we have in-house is now between 19 to 25, which is much more than what we saw last year with our surge.
How severe are the cases that you guys are seeing?
There are few of them, I would say around 10 to 15% of them are really sick and they are in our ICU. And those patients, they have co-infection with other viruses that happens during winter, like RSV, human metadenovirus, things like that. So that's what we are seeing.
So you were saying that you guys are seeing co-infections. Tell me about that again, and yeah, explain what that is.
So normally in pediatrics, which is very different from adult patients, when you come in or you get admitted, it's just one illness that you have. Very rarely you have 2 or 3 illnesses happening at the same time. But what we are seeing with COVID this time during this surge is there's more co-infection with other viruses that usually happen during the winter. So during winter, we see RSV, we see flu, we see human metapneumoviruses. So last week we had more kids with co-infection than this week, but that's becoming more of a common theme, where they're not having just COVID, they have RSV, they have human metapneumovirus, they have rhinovirus, they have any of these other infections along with COVID. So currently around 10 to 15% of our patients, they have co-infection with other viruses.
And last week it was a larger percentage. Was it 80?
So in general, it's like 80% of the patients have it. That's what we're seeing across the hospitals. But for us, it was around 30 to 40% last week. This week, it's been around 15%.
Okay. And so is that making them sicker?
It does make them sicker. And then it takes longer for them to recover, right? Because you have 2 or 3 viruses attacking you at the same time. So the recovery time is a little longer.
How concerned should parents be about that? Like how often does that happen when you get 2 different viruses at the exact same time?
So very rarely, like I said, in pediatrics, it's very rarely you have 2 or 3 illnesses at the same time. So what we are advising parents is to whatever vaccine is available, like if it's flu and your child is eligible, get them vaccinated for the flu. COVID, get them vaccinated for the COVID, because then they can still get an infection, but it's very, very mild and they don't end up in the hospital needing care.
Makes sense. And so a question that some of our producers had is, if someone comes in with COVID or with maybe the flu, what do you isolate them as, or what do you call them? Are they just considered COVID patients, and do they count to COVID numbers? Is that how it works?
Yes, so they do come, they get counted in our COVID numbers. It also depends on what are they presenting for, because sometimes we also see, so we test every child who enters into the hospital when they get admitted to make sure, because the gear you wear is different when you enter into a room with a COVID patient. So I would say most of the time they're getting admitted not for the COVID, but for something else, like they have a broken fracture or they have appendicitis, and then they come in, you swab them, they have a COVID infection. We see a lot of our mental health unit patients with suicidal ideations, depression. We swab them, they come with COVID. So yeah, so they all come into our COVID numbers, but it's a handful of them who are actually getting admitted for COVID. And so then when they get admitted for COVID, it depends on what they're getting admitted for, then their isolation changes. If it's a regular thing, we put them in a regular room, but they are actually having significant infection from the COVID, they are on a ventilator, that isolation becomes different. It's something called as an airborne isolation is what is done for them.
And even when they have those co-infections with like flu and RSV and stuff like that, have they been coming in more with those and then finding out that they have COVID as well?
Yes, yes.
Got it.
Yeah.
Okay, perfect. Parents, besides getting vaccinated, what else can parents do right now to try to protect their children?
So I would say vaccinated, wearing your mask, making sure the mask covers your nose and your mouth, hand washing, like at least for 15 to 20 seconds, social distancing. avoiding crowded places, like even example, you're in an elevator, just 4 people in an elevator, depending on the size, at the 4 corners of it. Don't go into crowded places. If you're going to the supermarket and things like that, just being careful of hand washing and avoiding crowds. So those are the things we can do to protect ourselves as well as our kids.
Compared to all of the other surges we've had, how bad would you say this one is for children?
So this one, we are seeing more kids because the variant is more contagious. But it causes more of infection in the upper airways. So it is less sicker, but the number of people who get it is much more because it spreads much faster. But again, still our vaccine rates for kids is much less than what we would like it to be. So we are strongly advising everyone to keep vaccinating their kids if they're eligible so they don't get this infection.
What do you have to say to people who say, well, they're saying the vaccine isn't as strong against Omicron, and they're saying the booster isn't as strong as Omicron, so what's the point of getting it? And even
it is.
Yeah. Mm-hmm.
Yeah, it is. Like any other vaccine, right? Like, so we get a flu vaccine, you can still get the flu, right? But the flu, it's much milder than when it would be if you don't have the vaccine. So it's similar. You take the COVID vaccine, you can still probably get that infection. We are not saying it's 100% proof, but it'll be a very mild illness that you'll have and you'll recover quickly and you don't end up in a hospital needing care for the COVID.
Any other trends you're seeing with pediatrics right now?
So there's a lot of articles that come out, like pediatrics co-infection with high risk of diabetes. They are seeing that. And then we also see that there's some new, I think it's more in adults, but in peds, now slowly it's coming, like it can have neurological deficits, like strokes and things like that. So there's a lot of things we still don't know about the virus. We're just learning as we go, but it is causing some comorbidities down the road.
And you guys, like you said, hospital stays are shorter and you're seeing less deaths this time around.
Sorry, can you repeat that?
You said hospitalizations are shorter, and are you seeing less deaths this time around or more deaths?
So we never had pediatric deaths even during our last surge. So I've never seen any deaths from the COVID infection. It's mostly the death is the co-infection that happens, going to respiratory failure or something, but we have not any deaths from COVID.
Okay. Anything else you want to add that you think we may have missed?
I would still strongly advise people to get the vaccine. If they're eligible for the vaccine, wear a mask, wash hands. And I know people have a lot of questions about sending kids back to school. I would still advocate, just like the American Academy of Pediatrics, that kids go back to school because they still need that, working with each other and avoiding social isolation, because that has caused such a huge mental stress on our kids, leading to suicidal ideations and depressions. So we want the kids to go back to school, be with their friends, be in their social circle, and continue to be safe.
What are you guys seeing with that? Are you seeing more kids coming in depressed and after, doing such a long time on online learning?
Yes, because there's so much social isolation, right? Because when they go to school, they get to see their friends, they hang around the friends, see things, do things. Yes, they can do virtual, they still see, but you don't have that bonding experience. You don't have someone you can talk to. So we are seeing a lot of kids with depression, high risk of suicidal ideation. And then on the other hand, you also see if kids are getting abused or not getting enough meals or things like that, all that gets missed because they're not going to school, they're staying back at home. So it's got a lot of mental and psychosocial issues, keeping them at home and teaching them virtually. So we keep advocating for them to go back to school as long as everything stays safe.
Okay. And this might be for another story and another interview at another time, but I would be interested to hear just some numbers of just how big that increase has been for you guys and seeing those type of things. Because I've done a lot of stories this week with schools, and they're just really fighting to keep kids in school however they can because they've just seen tremendous depression for those kids. So
yeah, I know for sure. We have some numbers and we have a very high spike in our mental health patients. And there's not enough mental health resources also in the community. So it's just hard for these kids to find something.